So, good evening, everyone. So today we'll be dealing with pharmacology with one of the most prominent topic called cholinergic drugs. So I think you might have studied about the previous topics regarding introduction to the pharmacology and what are all the dosage uptaking methods and the amount of dosage given to a person. So I'm not going to discuss about regarding about that. So directly we'll be moving to the topic called cholinergic drugs. So before getting into the deep of the topic, we'll be discussing about the nervous system. As you all aware about that, the nervous system is divided into two parts in our body. One is CNS. So what you usually call it as central nervous system, and another system we call it as ENS. What you call it as autonomic nervous system. So is in CNS, it consists of brain and spinal cord. So I'll be writing it in an abbreviation form. So CNS consists of brain and spinal cord, and ANS consists of the nerve fibers. Usually the nerve fibers which form connection between. I'm sorry for the spelling mistake. So let me correct it down. Between the CNS and the side, the sensory side, what you call it as sensory side. So again, if you talk about the CNS, it consists of again another again two parts. What you call it as? Sorry, it is PNS. I'm really very sorry for the mistake. It is called as PNS. So again, PNS is divided into another part called as ANS. What we call it as autonomic nervous system. So again, autonomic nervous system is again divided into two parts. One is sympathetic nervous system, and another one is parasympathetic nervous system. So I think you might have you are aware with these two terms, sympathetic and parasympathetic nervous system. So what like if we talk about these two terms in anatomical terms, so we first we'll be taking up with the parasympathetic system. So if we talk in terms of anatomical terms, usually as you are known that between the two neurons there is a junction. So you name that junction as ganglia. The junction between two neurons is called ganglia. So how do we what is the structure? The usually the junction between two neurons is called as ganglia, but what is the core structure of parasympathetic system? How does this ganglia comprises the nervous system? So if you talk about the structure, usually we define the junction, if there is a junction between two neurons, then the neuron before the ganglia is called as preganglionic axon, and the neuron which consists above the ganglia is called as postganglionic axon. So again it consists of two parts called as preganglionic part and postganglionic part. So if you talk about parasympathetic system, usually the preganglionic part is shorter than postganglionic part. Postganglionic part. Okay. So like let me draw the structure for you. Sorry for the diagram because I'm very poor at the diagram, so you may please take it as a consideration from me. So okay, let's get into the topic. So this is the CNS system and this is the axons arising from it. This is preganglionic part and this is postganglionic part, and between these two neurons is the junction, or also what you call it as ganglia. So now getting into the pharmacological part. If you talk about this system in pharmacological aspect, usually we call parasympathetic system as cholinergic system in pharmacological part. So what is the reason behind that parasympathetic system is also called as cholinergic part? So the reason behind it is, as you are all aware of the one of the most prominent neurotransmitter called acetylcholine. It is one of the most prominent neurotransmitter in our body. So how do we why do we name the parasympathetic system as cholinergic system also? So the reason behind it is, the neurotransmitter present in both preganglionic part and the postganglionic part is choline and acetylcholine. So if you if you take in terms of that aspect, in terms of neurotransmitter, then we can also name it as cholinergic system, as both preganglionic and postganglionic parts secretes acetylcholine as the form of neurotransmitter. So that's why we call parasympathetic system as cholinergic system. So if you talk about the ratio between these two axons, the ratio in the sense the length of the neurons between these two, so either it may be 1:1 or 1:100. I'm sorry. So this is about the cholinergic system. So why do we call it as parasympathetic system? What is the reason behind it? Usually parasympathetic system is active. It is active during relaxed state of the body. State of the body. So during relaxed state of our body, our pupils are dilated. There is increase in saliva, increase in secretion in each and every part of our body. You may either take it about salivary glands or either sebaceous glands or sweat glands. Increase in secretions or even gastric secretions, and the urinary bladder is always relaxed. The muscle in the urinary, what you call the detrusor muscle, it is always relaxed. Okay, so this is the reason why we also call it as parasympathetic system is also active during the relaxed state of our body. Okay. Now coming up to the sympathetic system. Now if you as I mentioned above, if you take in terms of anatomical aspect, usually it is inverse of parasympathetic, means like the preganglionic part is long and postganglionic part is short. Okay. Usually the ratio varies in this type of system. So there is no the specific ratio for this kind of system. Now coming up to the reason why we usually call sympathetic system as anticholinergic system or adrenergic system in terms of pharmacological aspect. We also name sympathetic system as adrenergic system in anatomic in pharmacological aspect, I'm sorry. So why do we name adrenergic system as adrenergic system for sympathetic system in pharmacological aspect? So the reason behind it is, as I have said, in parasympathetic system, both the neurons, means the preganglionic part and the postganglionic part, both the neurotransmitter secreted by both the ganglions are acetylcholine. But if you take in terms of adrenergic system, in preganglionic part, as it is the neurotransmitter is acetylcholine, but in postganglionic part, I'm sorry for the spelling mistake, it is either noradrenaline, as you are known that noradrenaline is the methylated form of adrenaline, or norepinephrine. Okay. This is the reason why we call the sympathetic system as adrenergic system in pharmacological aspect. Okay. So that's all I wanted to discuss about. This is just a basic brief introduction about the cholinergic system. So I'll be discussing about the mechanism and the drugs related to it. So I kindly